Medical Assistant Practice Test for General Knowledge 2023 500 questions with explained answers. Abnormal enlargement of the liver, hepatomalacia. Restating what the patient has said to verify that you have understood him or her correctly. Active listening. All of the following statements are true about a credentialed medical assistant except a credential guarantees a job. Behavior modification is an application of which type of psychological theory? Behaviorism. Behavior of professional ethics. Body is in a state of equilibrium or balance. Homeostasis, bruise, hematoma. Communicating with a visually impaired patient, medical assistant should introduce himself or herself to the patient when entering the room. Condition of total paralysis affecting only one side of the body. Hemiplegia, COPD. Chronic obstructive pulmonary disease. Elizabeth Kubler-Ross's 5 stages of grief: denial, anger, bargaining, depression, acceptance. An example of providing privacy to a patient. Knocking before entering the examination room. Excessive amount of menstrual flow, menorrhagia. The following are attributes of a professional except being limited to jobs only in the medical field. Function of the respiratory system, air exchange. Gland that produces oily secretions that lubricate the skin. Sebaceous, inflammation of the brain, encephalitis. Instrumental use to view the interior of the ear canal is known as an otoscope, K-level, potassium. Medical assistant's ability to adjust to abrupt changes in a medical office environment. Flexibility, mentally impaired patients. Should be spoken to directly in simple, easy to understand terms. Myocardial infarction, heart attack. Myxedemy, also known as hypothyroidism. Not a breach of patient confidentiality by the medical assistant. Telling the patient's physician about the abnormal test results just received from the lab. Not defense mechanism, anxiety. Not true about cultural diversity. All cultures use the same nonverbal body gestures. Not true about the barriers to communication. Trust. Not true for seriously ill patients. The medical assistant should encourage the patient to think about happier times and forget about his or her illness. NPO. Nothing by mouth. Perla. Pupils equal, round, reactive to light and accommodation. Prefix myelo. Marrow. Prefix patchy, thick. Proper response a medical assistant should give to the statement, "I can't wait until this operation is over." You seem worried about the operation. Am I correct? Shingles is known as herpes zoster, spinal cord injury in which paralysis is on one side of the body. Hemiplegia, suffixes mean softening. Malacia. Suffix rupture, orexis. Superior means that a body part is above another part, or closer to the head. Surgical removal of the uterus, hysterectomy. Uncovering irrational beliefs is an important part of what type of psychotherapy? Cognitive therapy, URI, upper respiratory infection. Various types of verbal and nonverbal methods that may be used to convey messages, such as speaking, writing, and body language are referred to as channels. When a child asks whether a procedure will hurt, the reply to the child should be answered in simple, honest terms. Which of the following attributes in a medical assistant does the patient does not look for? Disinterest. Which of the following is sometimes called the coronal plane? Frontal plane. Which of the following statements is true about all elderly patients? All elderly patients prefer to be treated with respect. Sterilizations means that A. All organisms have been removed from an object. B. All pathogenic organisms have been removed. C. Debris has been removed with soap and water. All organisms have been removed from an object. Which of the following actions should the MA take to ensure disposable thermometers are ready for an exam? A. Make sure they have been autoclaved within the past 28 days. B. Ensure the expiration dates have not passed. C. Swab tips with alcohol. Ensure the expiration dates have not passed. What info will not be found in the medical record of the PT? A. If the patient admits to any illegal drug use. B. Personal opinion of office staff. C. Legal history of the patient. Personal opinion of the office staff. Using a tape measure to evaluate the head and chest circumference of an infant is called A. Auscultation. B. Mensuration. C. Palpation. Mensuration. What is the max time allotted for a collected blood sample to sit in a serum separator tube before being centrifuged? A. 1 minute. B. 5. C. 15. D. 30 minutes. AMA is giving a DPT injection to a 6mo. The assistant would administer the injection where? A. Upper outer quadrant of gulp. B. Deltoid muscle. C. Vastus lateratus. D. Subtissue of thigh. Subtissue of the thigh. If the physician is going to do a pap smear, the MA should have which of the following equipment? I. Curette and dilator. B. Speculum and water-soluble lubrication. C. Suture and removal kit. D. Hemocult tray. Speculum and water-soluble lubrication. Emergency treatment for a second-degree burn would include A. Bandage tightly. B. Breaking any blisters seen. C. Applying clean, cool, wet cloth to the area. D. Scrubbing the site with antiseptic. Applying clean, cool, wet cloth to the area. Evaluation of the spinal column is accomplished easily from which of the following positions? A. Knee chest. B. Prone. C. Supine. D. Lithotomy. E. Trendelenburg. Prone. To respect the patient's privacy while obtaining information about their HX, you should A. Ask patient to fill out form rather than ask them in an interview. B. Ask PT to specify people who can give information about her. C. Take the PT to a quiet and private area. D. Let the doctor ask them the questions. Take the PT to a quiet and private area. Which term is defined as the concentration at which a substance in the blood, not normally excreted by the kidneys, begins to appear in the urine? A. Surnaudant. B. Refractive index. C. Renal threshold. D. Micturition. Renal threshold. The PT is having occult blood in the stool caused by a medication that they are taking. Which medication would you suspect? A. Lisinopril. B. Coumadin. C. Prozac. D. Ativan. Coumadin. If amide is A. An animal or insect that can transmit disease. B. A method of removing pathogens. C. An inanimate object that can harbor pathogens. D. A sexually transmitted disease. An inanimate object that can harbor pathogens. To correctly treat an adult with a foreign body airway obstruction, the MA should first I. Open PT's mouth and remove any foreign body that is seen. B. Lower PT to the floor and start to perform abdominal thrusts. C. With the left hand check the pulse at the left carotid artery. D. Ask the PT as he can speak. Open PT's mouth and remove any foreign body that is seen. The Ishihara test is used to diagnose A. Myopia. B. Hyperopia. C. Presbyopia. D. Color blindness. Color blindness. A non-sterile item is accidentally added to a sterile field being prepared for the suture of the skin. Lack. Once the MA discovers this, they should I. Report it to the physician. B. Remove it at once. C. Leave it on the field but cover it with a sterile towel. E. Redo the sterile field and resterilize any instruments. Redo the sterile field and resterilize any instruments. The process used to wash and remove tissue from medical instruments is called I. Asepsis. B. Disinfection. C. Sanitization. D. Sterilization. E. Boiling. Sanitization. Which of the following is the max amount of time a tourniquet should remain on a PT's arm during a routine venipuncture? A. 30 sec. B. 60 sec. C. 2 minute. D. 3 minute. E. 5 minute. 60 sec. In a large-scale national disaster or disease outbreak, which considerations should be taken? A. Some PTS will come to the office for care due to the overcrowded. B. The practice may need to administer vaccinations or immunizations to PTS. C. Open lines of communication with local public health officials and participation in coordination plan. D. None of the above. All of the above. All of the above. Employment, use of tobacco and alcohol, and exercise habits are listed where in the PT chart? I. Social HX. B. Chief complaint. C. Review of systems. D. Medical HX. Social HX. If your PT is being treated for a severe upper respiratory infection, which meds would you not expect to see ordered? I. Amoxicillin. B. Albuterol. C. Robitussin. D. Hydrochlorothiazide. The microscope condenser is responsible for A. Collecting and concentrating light rays. B. Holding and moving the slide. C. Controlling the amount of light focused on an object. D. Coarse and fine adjustment for object focus. Collecting and concentrating light rays. You should suspect that a PT might possibly be having a heart attack if she is complaining of A. Blurred or double vision. B. Severe headache. C. Pain in the shoulder or jaw. D. Difficulty understanding spoken words. Pain in the shoulder or jaw. When drawing multiple tubes of blood via venipuncture, what is the correct order based on the colored tube stopper? A. Lavender, red, green, yellow. B. Red, yellow, lavender, green. C. Green, yellow, lavender, red. D. Gray, yellow, red, blue. E. Yellow, red, lavender, green. Yellow, red, lavender, green. Which of the following is ACLI, a wave low complexity test? A. Microscopic examination of urine. B. Gram stain. C. Blood chemistry. D. Pregnancy test. Pregnancy test. Normal respiratory rate for an adult is A. 8 to 12 bpm. B. 8 to 16 bpm. C. 12 to 20 bpm. D. 12 to 26 bpm. E. 20 to 26 bpm. 12 to 20 bpm. After drying and removing packs from the autoclave, the first thing you should do is A. Place newly sterilized packs under the older ones. B. Discard all outdated packs. C. Check the indicators to make sure it has changed colors. D. Mark packs with your initials and the date sterilized. Check the indicators to make sure it has changed colors. Which of the following medications would not be ordered for an elderly PT with cardiovascular disease? A. Lanoxin. B. Lasix. C. Potassium chloride. D. Lisinopril. Prozac. To be prepared for an office emergency, you should A. Keep policies for emergencies nearby for reference. B. Ask more experienced person to handle it. C. Review policies and be aware of location of emergency supplies. D. Call 911. E. Make a list of emergency phone number and place it near the phone. Review policies and be aware of location of emergency supplies. Examples of a bandage include A. Steri-strips. B. Telfa. C. Tubular gauze. D. 4x4 gauze. E. Clear of sight, tubular gauze. Which test is used to determine the best antibiotic to treat a condition? A. Blood agar. B. Culturing. C. Morphology. D. Liquid culture medium. E. Sensitivity. A blind weight is done on PT by A. Not writing the weight in the PTS chart. B. Asking the PT to weigh at home and report it when he comes in. C. Weighing the PT in the wheelchair and subtracting the weight of the wheelchair. D. Shielding the readout so the PT is unaware of the result. E. Shielding the readout so the PT is unaware of the result. An effective way to handle PT emergencies in a medical practice office is to take what steps in advance. A. Ask very sick PTs to go to the B. Identify the at-risk situations that are most likely to occur, given the PG population, and prepare to provide care for these situations. C. Make sure that a doctor is constantly available. D. Have a first aid kit. Identify the at-risk situations that are most likely to occur, given the PG population, and prepare to provide care for these situations. In the event of a large-scale bioterrorism, what steps would not be an approach to be used by a medical office practice? A. Coordination with local public health officials. B. Providing vaccines. C. Knowing S&S related to the disease outbreak. D. Sending PT to her for diagnosis. Snellen testing results give information about A. Blood sugar results. B. Visual acuity. C. Ability to hear vibratory sound. D. Blood pressure. Visual acuity. Which emergency situation should receive first priority? A. Bleeding from a lac on the arm. B. Occluded airway. C. Open fracture of a femur. D. Mid-sternal chest pain, occluded airway. The AMA's role in obtaining informed consent is I. Explaining risks and benefits of the procedure. B. Making sure PT understands and has no questions. C. Answering all the questions that the PT has. D. Witnessing the signature of the PT. Making sure PT understands and has no questions. To remove sutures, the MA should have a tray of instruments including A. Kelly hemostat. B. Neo scissors. C. Sen retractor. D. Litar sixers. Litar sixers. When there is an unidentified clear liquid on the floor of the exam room, after a PT leaves the room, the MA should go ask the PT if they are aware of what the liquid is. B. Clean up the spill with a disposable paper towel and place in bio bag. C. Put up wet floor sign and call housekeeping. D. Put on disposable gloves, clean up the spill with disposable paper towel, place in bio bag. Put on disposable gloves, clean up the spill with disposable paper towel, place in bio bag. A viral infection. A. Cannot be transmitted by droplets. B. Will always resolve in 7 to 10 days. C. Does not respond to antibiotic treatment. D. Causes tuberculosis. Does not respond to antibiotic treatment. Factors that affect the action of drugs include all except A. Body weight. B. Use of generic medication. C. Sex. D. Age. Use of generic medication. When checking supplies in the office, the MA notices an instrument in the cupboard was autoclaved 28 days ago. They should A. Check for damages. B. Count to see if there is enough for expected procedures. C. Place packages back in the autoclave and run. D. Unwrap, repack, and run autoclave. E. Redate the packages with an additional 28 days. Unwrap, repack, and run autoclave. Symptoms of insulin shock include A. Fruity or acetone smell to breath and a decreased blood sugar. B. Tremulousness and an elevated blood sugar. C. Diaphoresis and a fruity smell to the breath with elevated blood sugar. D. Confusion, tachycardia, and an elevated blood sugar. E. Diaphoresis, tremulousness, confusion and decreased blood sugar. Diaphoresis, tremulousness, confusion and decreased blood sugar. Which of the following steps helps ensure smooth operation in the office during a PT emergency? I. Adhering to a pre-established plan and protocols. B. Avoid setting apps for seriously ill PTs. C. Range for close proximity to the localer. D. Clear office during PT emergency. A. Have an AED. Adhering to a pre-established plan and protocols. Prior to administration of local anesthesia, the MA should I. Administer a test dose to test for allergies. B. Ask PT if they have had it before and use the same medication. C. Carefully take an allergy HX from PT. D. Make sure PT has a post-procedure driver. E. Look in the chart so see if PT has previous surgical HX. Carefully take an allergy HX from PT. The knee chest position is used for A. Proctological exams. B. Vaginal exams. C. Exam of the chest and upper torso. D. PT who have difficulty breathing. E. Treatment of hypotension. Proctological exams. Which position should the PT be in for a vaginal exam? A. Prone. B. Lithotomy. C. Sims. D. Fowler's. Lithotomy. The first thing an MA should do when they come across an adult who is not breathing is A. Give to rescue breaths. B. Roll the PT to the left. C. Check for carotid pulse. D. Look into the mouth for an airway obstruction. Check the carotid pulse. When checking the sterile supplies, the MA should A. Unwrap and resterilize packages older than 21 days. B. Examine packs and discard any that are damaged. C. Range packs by expiration date. D. Seal expired packs in plastic to extend their life. Examine packs and discard any that are damaged. Sterile technique must be used when A. Placing sutures in a new lac. B. Removing sutures from a healed lac. C. Performing an eye fog. D. Performing a pap smear. E. Placing sutures in a new lac. Which measurement is a normal specific gravity of urine? A. 1.00. B. 1.025. C. 1.050. D. 1.125. 1.025. What is a disposable glass or plastic tube used for hematocrit determination? A. Microcollection tube. B. Capillary tube. C. Reagent tube. D. Serum separator tube. Capillary tube. Which medication would most likely not be ordered for a 50-Y postmenopausal woman? A. Premarin. B. Provera. C. Recept. D. Calcium citrate. E. Multivit. Recept. The ratio for making a disinfectant pro bleach and water is A. 1:5. B. 1:10. C. 1:20. D. 10:1. E. 1:100. 1:10. To screen for hearing acuity or bone conduction of sound, the medical assistant would use A. Otoscope. B. Ophthalmoscope. C. Tuning fork. D. Snellen test. Reflex hammer. Tuning fork. What is not considered proper PT instruction for obtaining clean catch midstream urine sample? A. Have PT remove undergarments. B. Make sure not to touch the inside of the container. C. Continue to hold labial apart and void a small amount into the toilet. D. Wipe back to front. Wipe back to front. If AMA discovers a known diabetic PT who is disoriented and confused, the first thing they should do is A. Check vitals. B. Administer glucose. C. Check sugars. D. Check for spontaneous respiration. Administer glucose. A procedure that AMA would not expect to take part in when doing minor surgeries in the office is A. Suture of lax. B. Biopsy of lungs. C. Cyst removal. D. Biopsy of skin lesion. E. IND of wound. Biopsy of lungs. Heart sounds that are heard when the blood pressure is being measured are called the A. Korot cough sounds. B. Rin sounds. C. Snellen. D. Isharher. Korot cough sounds. The popliteal pulse is located A. Thumb side of the wrist. B. Behind the knee. C. Dorsal surface of the foot. D. Apex of the heart, behind the knee. The most important thing to do to prevent the spread of infection is A. Use bio bags. B. Dispose of sharps in ridged container. C. Wash your damn hands. D. Disinfect PT care equipment between uses. Wash your damn hands. Which type of urine specimen contains the greatest concentration of dissolved substances? A. Random. B. First voided morning. C. Clean catch midstream. D. 24-hour. First voided morning. When moving a heavy object, one should A. Bend from waist. B. Ask for help after attempting it yourself. C. Keep object 5 inches from body. D. Assess object prior to attempt. Ask for help if needed. Assess object prior to attempt. Ask for help if need. When removing paper soiled with biohazardous material from the exam table, the AMA should do what? First, A. Use sterile gloves. B. Roll paper inward. C. Gather soiled paper in gloved hands and discard. D. Roll inward away from the body. Roll inward away from the body. In an infant, you should check the pulse in which of the following arteries in an emergency situation? A. Carotid. B. Radial. C. Brachial. D. Femoral. E. Temporal. Brachial. The generic name for Lipitor is A. Atenolol. B. Atorvastatin. C. Clopidogrel bisulfate. D. Furosemide. Amlodipine. Atorvastatin. After a PT has had a grand mal seizure, one would expect the PT to be A. Confused and drowsy. B. Excited and hyperactive. C. Hypotensive with decreased pulse. D. In need of airway management. E. Needing immediate transport to her. Confused and drowsy. The most appropriate position for a PT with respiratory problem is A. Trendelenburg. B. Fowler's. C. Lithotomy. D. Dorsal recumbent. Prone. Fowler's. Which is not a normal vein for phlebotomy? A. Cubital. B. Brachial. C. Hepatic. D. Cephalic. E. Basilic. Hepatic. Which of the following situations would be the least concern when involved in a sterile procedure? A. Talking over the sterile field. B. A member of the sterile team having loose hair. C. A non-sterile person entering the room. D. Adding non-sterile items to the sterile field. E. A tear of the glove. A non-sterile person entering the room. Draping is done primarily for convincing doctor. B. Keeping PT warm. C. PT privacy. D. Convincing AMA. PT privacy.